Hello, I'm Breanna Hetland, and I will be sharing more about the Family Room mobile app, a powerful tool that positively impacts patient satisfaction, care coordination, nurse burden, and ultimately contributes to the financial success of hospitals. I'm a critical care nurse. I've been the daughter of a severely ill patient, and I'm a leading research expert in family engagement in healthcare. And I can say that without a doubt, the patient, family, and provider dynamic during acute illness is very broken. Patients feel isolated and protocolized, lacking a sense of personal identity. Families are overwhelmed and they feel disconnected. Nurses are frustrated and subsequently they are leaving the profession. While the system is broken, it is not beyond fixing. With the Family Room, we are humanizing the care experience and improving the financial profile of healthcare organizations. Effectively engaging families during acute illness is critically important. With our solution, we are enhancing patient and family satisfaction and care coordination. We are decreasing nurse burden, and ultimately, we are increasing cost savings. And here's why these targets are important to financial success. First, active family involvement in care improves satisfaction scores, of which hospitals are evaluated and paid. Implementing patient engagement strategies has been shown to increase satisfaction scores from the 10th to the 95th percentile. Next, when families are involved, care coordination improves. This leads to smoother transitions between healthcare settings, lowers cost, and improves patient outcomes. And last, family participation in patient care helps alleviate the burden on nurses, which results in improved quality of care and reduces turnover. As you can imagine, this is a complicated problem to solve. There are national calls for family involvement, but current care models limit family participation to passive roles and lack consistency in implementation. We don't have accessible tools at the bedside to guide families on how best to contribute to patient care. Families need real-time education, a sense of connection, emotional support, and the resources that can enable them to do meaningful caregiving. The Family Room mobile app provides families with the ability to actively contribute to patient care. This not only benefits the patients, but the entire healthcare system. Healthcare is changing rapidly. The Family Room is timely because the government-sponsored value-based care program rewards higher patient satisfaction by providing higher reimbursements for hospitals. Additionally, worsening nurse shortages have put incredible strain on the entire system. Ensuring nurse support and maintaining manageable workloads are critical to reducing turnover. And lastly, in order to be successful, the rapidly growing hospital at home market will require that families be essential members of the care team. The Family Room app will have significant financial impact on the healthcare market. Our early target market segment is community-based hospital intensive care units. But you can see that the app is poised for significant growth and success, especially with considerations for future use in the hospital at home sector. The Family Room revolutionizes the role of families in patient care. With our app, families feel heard, valued, and included as part of the healthcare team. Its success has been proven through a clinical trial at the University of Nebraska Medical Center. It is currently in use and has been validated by patients, families, and nurses, and it's been endorsed by hospital administration. Users have highlighted the ease of use, the value of information, and the appeal of the app's graphics. Families that use the app reported lower anxiety and depression, as well as improved satisfaction. The Family Room has 4 main features. First, unit and hospital-specific information and tailored education gives families exactly what they need to know in a very simple way so that they can better understand their caregiving role. We use AI technology to provide families with short daily summaries of the patient experience right on their smartphones, allowing them to stay updated as well as share important patient-specific information with healthcare providers. Emotional support is crucial for effective caregiving. Our app provides a comprehensive resource hub with self-care strategies, peer support forums, and caregiver-specific stress management guides. And lastly, we give families virtual training on comfort-focused care activities that they can do right at the bedside. We also teach them how to measure and record the effectiveness of the care that they provide. As a nurse myself, I know that none of these efforts will be fruitful if we don't successfully implement solutions like the family room into existing workflows. That's why we've designed our app in partnership with practicing nurses who enthusiastically endorse it for its ability to save clinical time, mental energy, and provide structure and guidance around family involvement in patient care. We offer a simplified tiered pricing plan based on the number of beds per unit, along with a one-time implementation fee. Our pricing includes value-added services such as access to a learning community, customer support, and engagement metric analysis. Currently, there's a significant gap in the market for a tool that directly supports family caregiver involvement. Existing apps primarily target neonatal populations or individuals outside of the acute care environment, and they focus mainly on communication. The family room stands out because it directly addresses the unique needs of family caregivers during a patient's acute illness. It includes innovative family member and nurse endorsed features with a user-friendly interface, and it enhances communication, support, and active caregiver participation in patient care. We have successfully raised $600,000 in non-diluted funding. We are now targeting a $1 million raised to be used for sales growth, team building, and product innovation. With the planned funding allocation, we aim to accelerate our growth trajectory and expand our reach in the healthcare market. We will focus on scaling our user base, enhancing our product, and establishing strategic partnerships that can drive adoption. We have an expert team with complementary skills in family engagement and healthcare innovation, as well as human-centered design and change management. We also have established relationships with technology experts from both industry and healthcare that have already strategized integration and delivery plans for the family room. To close, the family room is a powerful tool that positively impacts patient satisfaction, care coordination, nurse burden, and ultimately contributes to the financial success of hospitals. Thank you so much for your time and attention today, and I'm really looking forward to your questions.